My parents are actually both doctors, and my dad was also in the Army, so we moved around for jobs and, of course, because of different assignments. So I thought I would never be a doctor. I thought, I don't want to do that, so my parents do. As it turns out, it's really fascinating. So I tried to stay away, but it didn't work. I had this really smart mentor one time when I was just starting medical school, said, never pick what you're going to do with your life based on interest in a disease or interest in an organ. You should always pick what you want to do based on who you want to treat. And gosh, I hate when they're right. He was right. So that's what I did. I picked who I wanted to treat, and I love to treat kids. There's a lot of people who work behind the scenes, and there's a lot of action that happens behind the scenes that I think people don't realize sometimes. You know, we come in to a hospital room and see a patient, and there's questions and concerns, and then, you know, we leave, and there's sort of this blank space in the family's experience. Really what's happening is that all kinds of stuff is happening behind the scenes. We're talking to the radiologist, we're talking to the pathologist, we're talking to the lab folks, we're talking to the other physicians on other teams to really put our heads together to figure out exactly what needs to happen for that patient, and, you know, then come back 4 or 5 hours later with the ability to answer the question. Again, they're seeing maybe 1 or 2 people in that initial encounter, and then maybe 2 or 3 people in the follow-up, but there's probably dozens of people who are involved in the interim that they don't see. There's a pretty common saying in pediatric surgery, which is, children are not little adults. There is a spectrum, not just of age and size, but also of physiology and the way those patients work. And everybody who works in the children's hospital has gone through all the same training that people who treat adults have gone through, and then they do additional training to learn how to treat children. And that special time and attention to treating the patient individually based on age, disease, pathophysiology, you just can't get that anywhere else. You get that at a children's hospital. That's why people come here.